Hello, this is Dr. JoAnn Manson, Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. I'd like to talk with you about a recent report from the large-scale Black women's health study published in the new journal NEJM Evidence. This study looked at the association between hypertensive disorders of pregnancy, including preeclampsia and gestational hypertension, and the risk of subsequent stroke over the next median of 22 years. Now, there have been previous studies linking hypertensive disorders of pregnancy to an increased risk of stroke. However, most of these studies have been done in white women of European ancestry, and there's been very limited evidence in Black women, despite a disproportionately high risk of having a hypertensive disorder of pregnancy and also a disproportionately high risk of stroke. Now, this study in more than 40,000 U.S. women did find an increased risk of subsequent stroke among women with a prior history of hypertensive disorder of pregnancy. Overall, a 66% increased risk. And with gestational hypertension, an 80% increase in risk and about a 50% increased risk with preeclampsia. Now, we know that pregnancy itself can lead to some remodeling of the vascular system, but we don't know if there's a direct causal relationship between preeclampsia or gestational hypertension, these changes during pregnancy, and the subsequent risk of stroke. Another potential explanation, and it could be a combination of the two, is that these complications of pregnancy serve as a window into a woman's future cardiometabolic health and serve as a marker of her cardiovascular risk. But regardless, the clinical implications are the same. First, we would want to prevent these complications of pregnancy whenever possible. Some women will be candidates for the use of aspirin if they're at high risk of preeclampsia, and certainly monitoring blood pressure very closely during pregnancy. But also, it will be so important to maintain blood pressure control postpartum and during the subsequent years of adulthood in order to minimize risk of stroke, because hypertension is such a powerful risk factor for stroke. Will also be tremendously important to intensify lifestyle modifications such as increasing physical activity and having a heart-healthy diet. These complications of pregnancy have also been linked in other studies to an increased risk of subsequent coronary heart disease events and heart failure. Thank you so much for your attention. This is JoAnn Manson.